view, what policy frameworks were currently missing or underdeveloped that could better support genomic innovation at scale?
Sure. So I think one of the biggest missing pieces right now are national guidelines for the provision of genomics in both public health and medical settings. And I think to really establish that, you need to have use cases that are developed, especially in the area of surveillance. And also you need, very importantly, cost-benefit analysis. And both of these things need to be done at the national level, I think, in order for governments to really to have it aligned with their priorities, and for governments to have to really take it as ownership of doing this.
Are there countries or regions that could be used as a sort of a model for what works and what doesn't? And are some of those countries potentially in the global south?
Yes, I think there are a number of countries in the global south that have done this very successfully. I think Senegal is one of those countries that have done that very well. Bangladesh, looking to Asia, has also done this very successfully, and there's, I think, many others. I think countries like Rwanda are just starting to think about something like this, but they are bringing all the right stakeholders together to actually take ownership and have it developed for their own country and their own purposes and priorities.
What does it take to get those processes right? Is it just political will? Is it resources?
So I think actually part of it is resources. I think you need to have, I mentioned the cost-benefit analysis, which I think is super important, because once you have that in place, then you have other, not just the government backing it, but also insurance. And I think the insurance is an important part of this, because once they start backing coverage, this allows broader access. And so really these are things that must happen internal to each country to really broaden the use and scope. And once that happens, then you get more innovation in genomics as well.
And I swear this question is not me fishing. So I'm fishing. What have been the recent developments in the global health space that your organization has identified as major challenges in pursuit of your goals?
Yeah, I think, well, for us, AI and kind of digital health technology, the uptake of that has been wonderful, and it's been a great thing, but I think it also brings its own sets of challenges. One of those things being more data, faster data, so we can reach more people, but then we have more data now that we have to integrate into data streams that we're already having trouble integrating together. So I think there'll be a lot of challenges around that in the future.
So too much of a good thing is maybe not a good thing?
Somewhat, something like that.
Something like that. What has you excited though, that global public health is moving in the right direction?
Yeah, for me, and from the background that I come from is in prevention, and so for me, in global health, we've spent a lot of time being reactionary, right? Talking about responding to things, especially outbreaks, or to treating people that are already sick. And I think the conversation is turning more towards prevention now, so preparedness for outbreaks instead of waiting for them to happen, bringing together a One Health perspective on these things to think about each different sector and how those interplay for better health. I'm also talking about things like the long-lasting injectable PrEP for HIV prevention, and also actually destigmatizing different areas of health so that, especially in women's health, which enables access for these women to get preventive care screenings done ahead of time so that they're not showing up at the emergency room with an advanced stage of cancer. And so I think all of these things in a preventive way are really exciting, and genomics is part of every aspect of that and enables that to get better and better.
Is the picture as bleak? What's missing within Africa?
I don't think the picture is bleak at all, actually. I think the picture in Africa is incredibly inspiring and really optimistic. And it's because there's this collective work together on the continent, but then there's also the individual work going on in each country. Like I said, each country, they have some overlapping priorities, but individual needs that they need to respond to. And I think each of them coming through and taking care of that is creating a more sustainable future, I think, for us, instead of relying on external funding all the time that, as we know, disappears quite rapidly in the turn of events. But I think that is really the right road forward in order to make this a more sustainable endeavor. And I see that happening in Africa.
Last Africa CDC conference 2 years ago, there was a lot of talk about Africa becoming more independent, especially when it comes to funding. But then someone pulled funding, and I was shocked
Yeah.
at the amount of funding, especially coming just into South Africa. And I'm still wondering why we have a public health crisis if we have all of them coming in. Is that independence? Do you think that the scene has now been set that we forced to become more independent, or are things just going to collapse?
No, I think this is creating an environment where people are becoming more creative about how to fund different projects and programs that they had before. And allowing businesses to come in and make investments, which long term will be much better than relying on just external philanthropy. So I find it as a real turning point, and it's not going to be easy for sure, but I think it's going to lead to a better place in the end because we're doing the right things now to make it happen.
And then my last question is, what role do you think organizations like the IPSN and FAGE can play in pursuit of more effective and functional global health systems?
Yeah, that's a great question. I'm really excited about both of these organizations, and the fact that they're together now and working together is even more exciting because they have the unique ability to bring together scientists with policymakers, with funders, with implementers, importantly, and bringing them all in an interdisciplinary way together to discuss these problems and to make a plan. And I think they're really at a wonderful position to create the tools that are needed by individual countries that are tangible and that help them move forward in making things like their policies that they need to, and in changing how the internal funding structures work in those countries. So I think they have a real place as tool developers and implementers.
Do you think it appeals to funders, coming from that space, that organizations are working together? I know with WHO and Africa CDC, there are always complaints about duplication of tasks. So is that something that looms large?
I think that's going to be extremely attractive to funders because for too long things operated in silos and there was duplication of effort and we didn't get very far. But working together, I think, and in pooling resources, we're going to be able to do much more on less.